if your knees crack when you stand up, if your fingers feel stiff in the morning, or your joints ache for no reason, it's probably not your age. It's not wear and tear. There's one specific deficiency that almost every doctor overlooks, and by the end of this video, you'll know exactly how to check if you have it. Here's the thing. Joint pain isn't just an old people problem anymore. People in their 30s are waking up with stiff hands. People in their 40s are avoiding stairs. And most of them get told the same thing. It's just aging, or take some ibuprofen. But painkillers don't fix the cause. They just mute the alarm bell your body is ringing. And that alarm bell is trying to tell you something specific. Here's why this gets missed so often. Standard blood panels don't usually test for it unless you specifically ask. So you can have a perfectly normal checkup and still be quietly deficient for years, while it slowly affects your joints, your bones, and even your energy levels. So what is it? Stick with me, because in the next 60 seconds, I'm going to show you exactly what it is, and give you a simple self-check you can do right now, today, without leaving your house. The deficiency we're talking about is vitamin D3. Now, you've probably heard vitamin D is for bones 100 times. But here's what almost nobody explains. Vitamin D isn't just about bone density. It directly controls how your body absorbs and uses calcium and how it manages inflammation in your joints. When your D3 levels drop, your body can't properly regulate calcium. Some of that calcium doesn't make it into your bones where it belongs, and inflammation around your joints increases. That's the stiffness. That's the ache. That's the crackling. And the deficiency is incredibly common. Some studies estimate that up to 1 in 3 adults have insufficient levels, especially if you spend most of your time indoors, live somewhere with long winters, or have darker skin, which naturally produces less vitamin D from sunlight. Here's a quick self-check. You don't need a lab test for this part. Just be honest with yourself. Count how many of these apply to you. 1. Joint pain or stiffness, especially in the morning. 2. Fatigue that doesn't improve with sleep. 3. Muscle weakness or aches. 4. Getting sick more often than usual. 5. Low mood, especially in darker months. 6. Bones that feel more sensitive or achy under pressure. If you check 2 or more, it's worth paying attention to. This isn't a diagnosis. Only a blood test can confirm it, but it's a strong signal to bring up with your doctor. So what actually helps? First, sunlight. Just 15-20 minutes of midday sun on your arms and face, a few times a week, allows your skin to produce vitamin D naturally. Second, food. Fatty fish like salmon and mackerel, egg yolks, and fortified dairy or plant milk all contain meaningful amounts of D3. Third, and this is the part most people get wrong, if you take a supplement, pair it with vitamin K2. D3 helps your body absorb calcium, but K2 is what directs that calcium into your bones and joints instead of your soft tissue and arteries. Taking D3 without K2 is like turning on a faucet without a pipe to direct the water. Always check with your doctor before starting any supplement, especially if you're on other medication. One more thing almost nobody tells you. Vitamin D is fat-soluble, which means taking it on an empty stomach can drastically reduce how much your body actually absorbs. Always take it with a meal that has some healthy fat, like eggs, avocado, or nuts. If this helped you understand your joint pain a little better, hit subscribe. I break down one hidden health cause like this every week. And if you want to know the 3 warning signs your body gives before joint pain even starts, watch this video next.